Hello everyone and welcome to this audio podcast. Excuse me, this audio podcast as part of a Hilium Space edition or series. This audio podcast as part of a Calibrated Morphology. Excuse me, and this audio podcast as part of a Storm Robotics production. In this audio podcast, a little bit around a little bit around the sort of differential diagnosis, differential diagnosis around hematuria, and looking at sort of the some of the investigations, that are part of the as part of the sort of the laboratory basis for hematuria. So investigation. One investigation sort of historically has surmised sort of various insights and epidemiology of sort of the underlying investigations and differential diagnoses for hematuria, and suggest that urinalysis and imaging techniques, imaging investigations together are required to evaluate the extent of hematuria in suspect or high risk recipients. Other work has provided a detailed insight into what diagnostic investigations are required, and these range from basic urinalysis to more sophisticated nephrological or urological investigations. However, some of the following can help as part of the differential diagnosis. So again, sort of urinary dipstick investigations using validated reagent sort of test strips or testing kits, cell morphology, cell morphology, and cell morphology, cell morphology looks at sort of the sort of microscopic basis around the morphology of red blood cells, for example, and then also ascertaining cell culture results, cell culture from for example microbiology investigations, and retrieving sort of cytology context as well, where after looking at cells, red blood cells, for example, and white blood cells, for example, looking at sort of the cytology where certain cells or cell types in around sort of in around the urinary tract can be useful, for example, and investigating voided biomarkers. So again, looking at sort of biomarkers that are significant or important around where for example nephrology, or from a renal context, or from a renal sort of context or basis, where biomarkers are linked to specific specific biomarkers are linked to hematuria, and or specific biomarkers are linked with sort of urological basis around hematuria, in around sort of the imaging and radiological, let's say, the sort of radiological basis. It is important to substantiate the differential diagnosis and conduct and carry out sort of imaging investigations, especially if reoccurring and progressive hematuria is evident. Some of the following sort of modalities have been sort of utilized to verify a diagnosis in regard to hematuria severity. So a plain sort of radiology or simple X-ray can help inform to an extent. Then there's sort of more sophisticated radiology, cystoscopy investigations, and then ultrasound. Looking at ultrasound can be useful, and then intravenous urography, intravenous urography, computerized tomography. Computerized tomography can be useful in sort of in looking at where severity around hematuria affects patients or recipients where anatomically there can be issues as well. And then magnetic resonance imaging, or MRI investigations can be useful as well. And then renal biopsy, however, only warranted when there is a transparent indication of where there's renal insufficiency, or there's renal insufficiency or renal decline. So the literature, sort of more prospective literature, may well inform of sort of more sort of investigations around sort of the laboratory basis and the radiological aspects. However, the investigations that have been mentioned here as part of this sort of published works, sort of retrospectively, are sort of the underpinnings, if you like, around sort of the basis for sort of starting the sort of investigations for patients or recipients in sort of diagnosing the extent of hematuria. So that draws this audio podcast to a close. It's been an audio podcast as part of the Hilium Space, the Hilium Space series or edition. This audio podcast as part of the Calibrated Morphology, and this audio podcast as part of a Storm Robotics production.